Hi, my name is Amanda Caceres. I'm currently a fourth year PhD student at the University of California, Davis, getting my PhD in chemistry. And my project focuses on the use of iron modulators as a treatment for type 2 diabetes. So when we think of diabetes, we don't typically think of iron. But what's interesting actually is that in people who have diseases that cause iron overload, meaning they have way too much iron in their body, they are more likely to develop type 2 diabetes. And in addition to that, when we think of diabetes, we actually think of obesity. And so obesity is actually the best predictor for diabetes, and it's associated with anemia. So what we end up with is this kind of balancing act with iron regulation and diabetes. And so my goal is to kind of target that and exploit it, using it as a target for therapeutics. And so one of the things that we're doing is taking iron modulator compounds, or compounds that can move iron throughout your body, and testing them as anti-diabetic drugs. And so we use rodent models for diabetes. So mice get diabetes by eating things like a high-fat diet. And what we find when we do these rodent models and we treat with these iron modulating compounds is that the mice actually lose a good amount of weight. And in addition to that weight loss, we look at their liver fat content, which is what causes the insulin resistance typically associated with type 2 diabetes. And so if we look at a few markers for fat, what we see is that treatment with this modulator decreases fat production. And when we look at their tissue, what we can see is the staining for fat actually shows a decrease upon treatment. And so what that tells us is that their livers are not producing as much fat anymore. And accompanying that is actually a shift in their iron regulation. So when we look at some markers for iron, what that shows us is that this free labile iron that's normally floating around in your body is getting bound up by our iron modulator and moved into the liver into a protein for iron storage, and kind of pulling it out of the system. And so overall, these studies have shown us that our treatment with an iron modulator is able to restore normal fat accumulation and iron regulation in these mouse models for type 2 diabetes, which is a really promising result. And so with that, I'd just like to thank my lab and Professor Hepburn and the ARCS Foundation for allowing me to continue working on this research, and also sharing it with outside communities, which is really great to kind of spread the word on what we're doing here in our lab.